problems. But it was actually doing very well at the end of Labour's term because they put a lot of money into it, waiting lists came down, and it was at its highest level ever for public satisfaction. It was actually a pretty good service. And so it needed this disorganisation like a hole in the head, really. And what the Tories did was, first of all, they didn't tell us what they were going to do, and they admitted that. But Michael Portillo said so in a TV programme. He said if they'd known we were going to do this, they'd never have voted for us. So they lied about what they were going to do. In fact, they promised us they weren't going to have any more top-down reorganisations, you'll probably remember. And then they had to justify what they were going to do by running down the NHS in order to present us with this change in things. And then they presented us with something which has made an absolute dog's dinner out of it, predictably made a dog's dinner out of it, because they have made it incredibly... Here's what they promised us. It's going to be cheaper. No, it's actually more expensive. It's going to be less bureaucratic. No, it's actually more bureaucratic. It's going to give power to GPs. GPs are walking away in droves from this because it is so dreadful. And there's a very nice quote in the book from a GP, campaigning GP I work with. We've now got less money, more complexity, and all of the responsibility. GPs see they've been sold an absolute pup here, and they don't want it. And at the bottom line is that in all of this, the patients are really suffering, because as the NHS is fragmented and parcelled out to the private sector, the people who fall through the cracks in all of this are the patients. I see some of my hospital colleagues here. Hospitals are doing really badly at the moment. And we've got the perfect storm at the moment from this bill and coming in with, I don't know who has heard about Nicholson's challenge, the 20 billion cuts the NHS has got to make over 5 years, 4 years, 5 years. Anyway, billions of pounds a year, and those two things are coming together to make this perfect storm of destruction for the NHS at a time when it actually didn't need anything like this, and it was doing very well. So it's an absolute tragedy.
Can I press you a bit further? A lot of people say, I don't mind who's providing the service, private or public, so long as I get it. So long as it's funded out of public resources and I'm getting the service. I don't care if it's Richard Branson who's providing it or the old NHS. What's wrong with that argument?
Well, they will care very soon about whether it's Richard Branson
will
providing it. Well, first of all, they're going to have difficulty finding out that it's Richard Branson providing it, because what's happened is that this is all taking place behind the NHS logo. So the NHS logo is now for sale, and it's a jolly attractive thing to buy because it's one of the most attractive and trusted brand names in the world. So if you can run your service from behind the NHS logo, you're going to do very well. And what happens when the private sector come in? Of course, their first remit, legally their first remit, is to make a profit. That's what they're there for. You can't blame them. That's their job. But in order to make a profit, they have to start looking around, because the NHS is actually very cost effective. And for those who want to go in and look things up, the Commonwealth study, which is a big study that comes out from the States every so often, has identified the NHS was the second most cost effective health service in the world. Well, David should talk about some of this because it's really his area. But it was very cost effective. So if you're going to make money on it to give to your shareholders, you really have to start paring away at the things that cost money, and that's essentially the staff, because that's where a lot of the money goes. So you cut back the staff, you downgrade the staff, you abandon national terms and conditions, which has been one of the great glories of the national health system, that you could work in the Orkneys or you could work in the centre of London, and we all worked under the same terms and conditions, and that was very important for having people spread evenly around the country. So they start cutting away in that way, and they have no long-term commitment to the health service. So if you remember the breast implant scandal, two things were interesting about that when those breast implants it turned out that they were a very bad idea. One is the people who made them had gone bust, so there was nobody to answer to that. And secondly, the people who put them in said, oh, it's got nothing to do with us, and those patients pitched up in the National Health Service. So the private sector is very happy to be there when they can make money, and if they can't make money, they'll walk away. And if they think it's going to cost them too much money, they'll just turf that patient, because patients are now seen with pound signs over their heads. They'll put that patient back into the NHS again, and they don't want anything to do with the stuff that costs money and the patients who cost money. And they'll lie, they hide behind commercial confidentiality, we can't find out what they're doing, And those of you who follow might have noticed that Serco, for instance, who are delivering out-of-hours care down in Cornwall or Devon, lied 220 times about their figures down there, and oh yes, sorry, we did that, but there's no public accountability anymore. One of the three great characteristics of the NHS, which keep our NHS public, which I'm a founder member of, and I see some of my colleagues from the campaign here tonight. It was publicly funded, publicly delivered, and publicly accountable. And the publicly accountable is really important. We get there in the end, even with somewhere like Stafford, we get there in the end. But the private sector are not publicly accountable. They do not have to respond to freedom of information. They do not have to have their meetings in public, and so we are not going to know what goes on. So there's all sorts of bad things that are going to go on. Some of them are coming out already, and it's going to be really difficult to find out.
Thank you, Richard. There's time to bring David Drive.